Good morning! My name is Kay Groover, and I'm here to discuss an issue which is happening all over the world, and that is hospital detainments. This crisis is causing thousands of deaths per year and has received little to no international attention. But before we begin, I would like to discuss what the term detainment means. A hospital detainment occurs whenever a patient is unable to pay a bill after a procedure. The hospital escorts the patient under guard to an empty ward and does not release this patient until the bill is paid. Now let's explore the question of why are hospitals around the world being allowed to continue the practice of detainment, and how will it be solved? This is an occurrence happening in more than 30 countries around the globe. Countries on nearly every continent, such as India, Kenya, Bulgaria, Nigeria, and more, although conditions are the worst in sub-Saharan Africa and Southeast Asia. While this issue affects everyone in the countries which have hospitals committing detainments, women and infants are disproportionately victims. This is because the most frequent and expensive service provided by the hospitals is maternal care, specifically cesarean sections or C-sections. An example of this comes out of Kenya, where a recorded 8,000 women die each year related to pregnancy and delivery complications. Josephine Majani was almost another woman included in that statistic. To give birth, she went to Pumwani Maternity Hospital in Kenya. There she was forced to pay extra fees, abandoned, physically and verbally abused, made to walk by herself during labor to the delivery room, and finally had no choice but to give birth on the floor. Fortunately, Josephine's legal case made it to the High Court where she received compensation, but some other women at the same hospital were detained for months. Specific numbers for how many people are being detained in total are difficult to find, although speculations by Harvard's Global Health Institute are in the hundreds of thousands. Chapman House Research Institute has been studying this issue on a small scale and found that some hospitals have as many as 400 detained patients. In 2016, they performed a 6-week observation of a hospital in the DRC. During those 6 weeks, the hospital detained 46 of the 85 women eligible for discharge due to non-payments. That's 54%. The amount of time women stay there varies, although any amount of time away from their homes is detrimental to their own health and to their family's health. Women, and in some instances their infants, are not kept in adequate quarters. The area of detainment is typically an old ward of the hospital. Detained patients are put into crowded rooms with other sick patients, often without beds, running water, or bathrooms. The patients are not medically treated, and in many cases not fed either. Their families are responsible for obtaining enough funds to get them released, as well as tasked with bringing the detained patient food every day. This practice has been allowed to continue because of two main factors. The first is that there are systems in place within the countries where this happens to sustain the practice. For instance, in the DRC and Pumwani Maternity Medical Hospital, the armed guards surrounding the ward receive commission if they prevent an escape or find someone who has escaped. Should the patient actually escape, their bill is taken out of the medical staff's pay. This has caused many protests from doctors and nurses. Another problem is within the government itself. Many countries, such as Kenya and the DRC, have outlawed the practice of detainment, yet citizens are not made aware of their own rights. Politicians are well aware of the crisis and the laws against it. Instead of fighting for change, politicians often turn the issue to their own advantage. Right before an election, an official will go to a hospital and pay off all present debts, which earns him or her a loyal voting base and hero status. One politician doing so recently was described as a knight in shining armor, although this does not end the corrupt system and only supports it. The second main factor relates to the international community. One of the most important pillars for human health, the World Health Organization, is aware of the crisis, yet they do nothing. Dr. Agnes Sukkot of the World Health Organization states that the group does not support hospital detainments. They just have not been able to find data documenting where the detainments occur. Although an interesting fact overturned by the Chapman House Royal Research Institute is that the World Health Organization funds many hospitals which detain patients, such as Pumwani Maternity Hospital. In their recent report on women's health, the World Health Organization mentioned exact hospitals and countries where this crisis is most prevalent, yet they never even referenced the atrocities happening. The United Nations has also not been very helpful. In 2006, an article by the UNICEF, the United Nations International Children's Emergency Fund, provided an update on maternal health in Burundi, which was improving. While the article did give a short reference at the bottom to hospital detainments, the issue was not credited as a larger crisis. The article also left out that the efforts to improve maternal health in Burundi were actually reactions to the growing crisis of hospital detainments. As this issue grows, it is important to consider solutions. In Burundi and Turkey, this issue has almost been eradicated through banning hospital detentions, launching successful health financing reforms, and eliminating user fees for vital services. The only problem with their solutions is that they are costly. Burundi has had to rely upon international aid in order to complete its transition. However, given the decline in infant and maternal death rates, in addition to rising economic trends created by a more productive workforce, the price of this reform is definitely worth every penny. In 2005, President Pierre Nkurunziza of Burundi realized that hospitals had become debtor prisons. While he ordered the patient's release and banned the practice, the following year the crisis continued. President Nkurunziza and his administration determined that more extreme reform was required. He channeled public funding, including international aid, into the hospitals to remove fees and offer free maternity care. Women who had previously been avoiding hospitals because of detainment now gained incentives to give birth inside hospitals, which quadrupled the number of in-ward births. In the following 5 years after the transition, infant mortality rate declined by 43%. This issue is also prevalent in Burundi's neighbors, the DRC and Nigeria, which together represent 20% of Africa's population. If they made similar reforms, there would be a drastic drop of the global infant and maternal mortality rates. The World Health Organization itself admits that sub-Saharan Africa alone accounts for roughly 2/3 of maternal deaths. Reform in these countries would prop up their economies by allowing people to return to their jobs quickly after operations, and hospitals will receive a stable amount of income each year. Since this issue is happening all over the world, efforts to reform will relieve serious inhibitions upon the global economy. In the process of detainment and sometimes death, people being detained and their families working to get them released are not performing to their full economic potential. So, there you have it. If you have any questions, I would love to continue this conversation in person. Thanks for listening!